Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the video series about TENS. In this video series, we are going to learn different modes and parameters of TENS and how to apply TENS for pain relief. We will be discussing what are different modes of TENS and how it can be applied effectively to different parts of the body, different regions, and in different clinical conditions. We will also be discussing how to apply the electronic muscle stimulator or EMS or NMES for muscle strengthening. Right now I'm using the unit which is called as Vivo TENS. It has three functions in it. It has EMS, TENS and massage function. So let's turn on the unit and see what are the different features available. So if I've turned it on, you can see that there are different parameters right now. For example, if I click, this is on off and mode, and this is program, and this is the intensity level up and down for channel 1 and channel 2. Why we call channel 1 and channel 2? Because you can see there are these markings where we can see this is for channel 1 and this is for channel 2. So these are independently controlled channels, so we can use 4 electrodes at any given time. Now if I press the P button, you can see the program is being changed to P01, 2, 3 and 4 and 5. Then the same U1 is for user 1, that it is a customizable program we are going to discuss in a bit detail. Then similarly U2, U3, and there are 3 programs that are customizable in the EMS function, whereas the Pro stands for the programmed or pre-programmed. If I press M, it will change the mode and it is now into the massage mode. Again we will scroll or move through the programs. So the massage option is not customizable, it is just the fixed one. And if we go to the TENS mode, here you can see there are again the programs, and these programs are pre-programmed, we cannot customize them. But as soon as we see the U1, it is for user defined, and there are 3 protocols that a user can define. So for the program 1, 2, 3, 4 and 5, 6, you can search or read the manual that comes with this device. So I will be discussing how to customize these devices for your own patients or for your own self. So let's discuss the first program that we need to use. So you need to understand that there are basically 3 types of TENS. Number 1 is high frequency and low intensity. High frequency TENS is the TENS in which the frequency of the TENS or the stimulating frequency of the TENS is more than 50 Hz, but the intensity is minimum perceptible. And the second mode is low frequency and high intensity. So in the low frequency mode, the frequency is less than 50 Hz or 50 pulses per second, and the intensity is maximum tolerable or maximum bearable. Lastly, we have acupuncture TENS in which the frequency is less than 3 hertz, which is it ranges from 0.4 to 3 or 5 hertz only. And there are different devices available that can be used for the acupuncture TENS as well. So the parameters are really very simple. If you see, if I press this for certain period of time, let's go here and let's try to customize it. So if I'm going to press this P for longer period of time, here I can set the frequency, which is right now set to 60 hertz. I can reduce it. So above 50 it is high frequency. If we keep it to high frequency, then we need to stimulate at lower intensities, and below 50 hertz we need to stimulate at higher intensities. So first we need to set the frequency or the pulses per second. Then this is the pulse width. This is really very important. For small muscles we keep the pulse width minimum, and for large muscles or the larger area between the electrodes we keep the pulse width maximum. So inshallah in the next videos I'm going to demonstrate you different regions, how to stimulate them for pain and for muscle strengthening, and I'll be continuously changing the pulse width as well. So here you can see it is microsecond, so you can also change this. So this is set to, let's say 200, we can reduce it to about 100, let's say, and then that's it. So if we press this home button or menu button again, then it is set. And if we increase the intensity, you will see that it will not go beyond 4 or 5. The reason is that there is no contact between the electrodes, and this is a safety feature. So one by one we are going to discuss that what are the different electrode positions for different clinical conditions or for different regions of the body. I hope you will like this video. Please stay tuned and do subscribe my channel. Thank you very much.